My name is Wen Wee Ma. I'm an assistant professor in GI oncology and also phase 1 program at Roswell Park Cancer Institute. My focus is in seeing patients with gastrointestinal cancers, including pancreas and colorectal cancers. My research focus is in translating new treatment in pancreatic cancer. Pancreatic cancer is one of the very difficult to treat cancer. It's one of the most deadly cancer that we know of. Approximately about 40,000 new cases are diagnosed each year in the United States, but it's highly fatal. About 38,000 die from the cancer. With treatment, the survival for a patient with metastatic pancreatic cancer is about 6 months. So obviously over the last 1 to 2 decades, we've been looking at having different treatments to try to improve the outcome. So in this MPACT trial, what we're looking at is looking at a new treatment of adding a drug that is called Abraxane to be given in combination with gemcitabine to see if patients will receive this combination of Abraxane plus gemcitabine will have a better survival and live longer than if they receive gemcitabine by itself. And gemcitabine is FDA approved drug and is a standard for patients with pancreatic cancer. So what the trial found was that patients who had received the new treatment live longer than patients who just received gemcitabine by itself. The difference is about 1.5 to 2 months difference. So in the field of pancreatic cancer, that is a significant and big improvement compared to what we had before with gemcitabine. So from the MPACT trial, the 1-year survival for patients with stage 4 metastatic pancreatic cancer remains about in the region of 30 to 35%. And the survival is about 8 months. So to me and to many patients with this cancer and physicians treating this group of patients, that's still not enough. So we're looking at more novel and new ways of improving on this treatment. And one of the approaches that we'll be taking is to add additional new drugs, molecularly targeted drugs, to Abraxane and gemcitabine to see if we can further improve that outcome. Pancreatic cancer is one of those cancers that's really resistant to treatment such as chemotherapy and radiation. And I think to me, the result from the MPACT trial using gemcitabine and Abraxane represents a major milestone in pancreatic cancer treatment. It used to be that patients with stage 4 pancreatic cancer, the survival is 6 months, and now that we can meaningfully improve that to 8.5 months. So I think that's a significant milestone. Compared to other cancer types, may not be as much, but in pancreatic cancer, that is a very major milestone in developing the treatment.